Just a few things that we can do to treat cardiogenic shock is remember, go back to the ABCs. Airway. So most likely these patients need mechanical ventilation, and what mechanical ventilation does is actually decrease the workload of the body in general. It will also help decrease that fluid on the lungs from pulmonary edema. Another thing is, let's go to medications. Vasopressors, because remember, these patients have a low blood pressure. They have low perfusion throughout the body from the cardiogenic shock itself. So these patients need vasopressors. It increases the preload. It's actually clamping down on those blood vessels to help venous return of the blood. It constricts the vessels. Your blood pressure starts going up. An example would be norepinephrine. And so that is a perfect example to increase tissue perfusion and blood pressure. Sometimes they will use dopamine or dobutamine. Usually, if your blood pressure in cardiogenic shock is not extremely low, you can go ahead and do the dopamine or dobutamine. But in the case where your blood pressure is really low, let's say below 80 systolic, then usually we will give norepinephrine. Are vasodilators, because we think we give vasoconstrictors. Why are we giving vasodilators? They just work differently because we need to get the pressure up, we need to get blood moving through, but we also need to decrease the afterload. We need to make sure that that we make it easier for the ventricle to pump, so decrease resistance. It also dilates arteries, and it does help to increase perfusion to the heart muscle. So it's a good combination. You do have to watch for hypotension, though. Sometimes we have to end up giving the patient nitro. But again, with the combination of the vasopressor and the vasodilator, it usually balances itself out. But again, everybody's so different. Another thing to help with the pulmonary edema and decrease that extra fluid that's already been backed up are diuretics.